We're good to go. So welcome everybody to our Big Fat Masterclass. We are so happy that you are here. We're gonna spend some time tonight talking about confidence, and we love being in community with the folks who follow us, who know about us, who don't know about us yet. And this is one of the ways that we can get to know folks more and share a little bit about us and our journey and what we know.
So today we are going to talk about unlocking confidence, how confidence during labor lowers pain. And we are going to have a different topic every other day this week. So tomorrow on Tuesday, we're going to talk about anti-fat bias in prenatal care, recognizing and affirming your anger. On Wednesday, we are going to talk about debunking myths about fat birth. You are not a statistic. Thursday, we will be working on building community, finding support and cheerleaders. And on Friday is our last day, and we will talk about how to be an active participant in your pregnancy journey.
I'm so excited.
So, we want to do a little bit of an introduction of ourselves. My name is Emily Bernay. I use she, her pronouns. I am a doula and lactation educator. I have two little kiddos, 2 and 7. I also have a master's degree in adult education, which is kind of how I meld my passions here at Big Fat Pregnancy, that combo of being a doula and being an educator. I live in the Pacific Northwest and I am straight sized, I'm lesbian, middle aged, happy to be here.
Middle-aged. I guess we're gonna have to start saying that now.
Yeah.
Hi folks, my name's Christina. I use she, her pronouns as well. I also live in the Pacific Northwest. I am specifically on the stolen lands of the Coast Salish, Squamish, and Stillaguamish peoples. I also have two small children, four, almost five now, geez, and two. And I am also a certified doula, and I also have my master's degree in education. We are just ticking off the same. I should just do quotes every time you or like a +1 every time you say those things. I'm the founder and co-owner of Big Fat Pregnancy, and we exist to work with folks who live in larger bodies, who are going through the pregnancy, conception, or labor and delivery, postpartum phases. And we help equip our clients with the skills to push back on anti-fat bias and have positive and joyful and transformative births like they should be entitled to. So is this you, Emily? Yeah, this is you.
Yeah. So, welcome to our masterclass. Our goal this week is to build a foundation of knowledge around anti-fat bias in prenatal care and discuss some of the most common areas we see our clients struggle. So you can start your journey more prepared, confident, and excited. We want to encourage and empower you that pregnancy and birth are possible in a larger body, and talk about how you can get some of those skills.
So we recognize that we all come from different backgrounds, different levels. So before we get into the content today, we want to do just a little bit of definition clearing up, making sure that everyone's working on the same page. For this entire presentation and just in general, I predominantly use the words fat to describe both myself and the clients I work with. I live in a fat body. I always have, I always will. I also use plus size and folks living in larger bodies. Fat is not an insult for me. It's just a descriptor of the adipose tissue on my body. But you are welcome to use whatever makes you feel comfortable. That is totally fine. So we want to start by defining anti-fat bias so that folks know where we're at and what we're working to eliminate. And then I also wanted to briefly define body liberation, which isn't on the slide, but that's where we're going. So we want to talk about those two in tandem. So anti-fat bias, which is also known as weight bias, weight-based discrimination, fat phobia, refers to negative attitudes or beliefs or prejudices directed towards individuals who have a higher body weight or a larger body size. So this is what we're experiencing in prenatal care, which we'll talk about in just a minute, and what we want to be working to fight. And we want to be working towards body liberation. So this definition comes from Lindley Ashline. She is a big inspiration for me. She's based locally in Renton, Washington. And her definition of body liberation is freedom from social and political systems of oppression that designate certain bodies as more worthy, more healthy, and desirable than others. So we see this fat bias show up individually, person to person, and we also see it show up in the systems that we operate in. And that's what we believe primarily or predominantly body liberation is, right? It's moving through those systems of oppression to make sure fat folks can live a happy life where they have quality care and are treated equally or fairly, I should say. So for us, we focus specifically on anti-fat bias in prenatal care. Prenatal care is a really, really crucial aspect of ensuring that both the well-being of the pregnant person and their baby, and we are seeing anti-fat bias interfere with that care and well-being. And so I wanted to just briefly mention, some of the issues that we are seeing in prenatal care. These consequences can be both physical and emotional. They can be impacting someone's birth experience, their actual safety, and or the outcomes that they may experience in birth. Just some quick examples, we can see increased stress from folks experiencing anti-fat bias. This can be like immediate or what they're labeled as mandatory weigh-ins, even though that's absolutely not true. You do not have to be weighed. BP checks, and then of course those labels, right? Being labeled high risk due to BMI. That's one of the big one. It causes stress. It's like literally written over your whole entire chart, and it can be really stressful for folks. And that stress during pregnancy, during any time, but during pregnancy especially, is can be damaging. We also see some over and under screening for fat folks that comes out of bias. We see an over screening often for gestational diabetes, more growth scans than are necessarily needed. And we also see an under screening for eating disorders and possibly HD, which is the hyperemesis gravidarium. And so those are just some of the few ways that we can see bias show up in our system, and the things that we're working to educate you all and help you all feel confident to push back against.
So now that you've heard some of these ways that bias can show up in prenatal care, you may be asking yourself, why is it up to you to address weight bias in maternity care? It's a systemic issue. Shouldn't it be a systemic solution? And our answer to that is yes, but you are still an individual that is going to experience these things. And so we want to give you the tools and the skills to have a different experience at the individual level. We want to see broader systemic change, which is why we do lots of other kinds of actions. We work with providers on this. We talk to the legislatures about this as well, but we want to give you some tools so that you can have a different individual experience. So, one thing that we found really amazing about labor and birth is that confidence during this period can actually lower your labor pain. And that is very much related to anxiety. We found that through our research, 13% of expectant parents actually have a debilitating fear of childbirth. And the familiar request for C-section birth, commonly attributed to the fear of childbirth, is actually 10 to 20%. So 10 to 20% of families go get a C-section just because they feel afraid.
And that's crazy, because the nationwide C-section rate is like 33 to 40%, depending on where you're at. So that's like up to half, right, of C-sections or more are done out of fear, or attributed to fear, at least.
So we, are also doulas, and so we serve clients as they're giving birth. In case you don't know what that means, a doula is someone who's there to be the birthing person's support and teammate. And so many of our clients that we serve also have this anxious and nervous feeling about their own labor and birth. And so that's why we want to talk about why the confidence piece is so important to having the birth that you are hoping for.
Yeah, so Emily set that up very nicely. Confidence is something that we are um, hoping that all of our clients will walk away feeling more confident in their ability to birth. And when we talk about confidence within the maternal system, we talk about maternal confidence is really this belief that that a person can birth, right? That a physiological birth is possible, can be achieved. Birth is a normal process, and their belief in their body's like innate ability to actually birth. We also need to be supported in that confidence as well in order for it to kind of peak and be most valuable. Nancy Lowe, who is an associate professor in nursing at the University of Ohio, she's done a lot of research around confidence and labor experience, as well as postpartum experience. And she found that uh, birthing folks who reported low confidence were also super anxious about the actual event of birth. And in some cases, they were so anxious. Or so afraid that they felt incapable of using any sort of relaxation or breathing techniques or coping methods that would have made labor more bearable. So they were unable to use the skills that maybe they had learned, but because they were so afraid or so anxious, they couldn't calm down and they couldn't relax. And that increases fear. And you may not know this yet, but there is a increase in fear, increases tension, which increases pain. And it's a cycle that can go around and around. So confidence can help lower that pain. And for, most folks, right, there is some fear in childbirth. Fear of the unknown is totally normal. And a little anxiety, it actually does help us prepare, right? Helps us mentally prepare for the event. But when a person has such high fear and such low confidence, they start to doubt their ability to give birth. And in these studies that she's done, gestational parents in the high fear group tended to have lower self-esteem, and they were more likely to actually kind of place the doctors or the nurses in charge of their birthing experience or their overall health, which takes away their part in the experience, and kind of helps, it kind of encourages that sense of control, loss of that sense of control, which also contributes to a positive experience. So in this confidence rate, it doesn't just stop in labor and delivery. What we also look at maternal confidence postpartum, and that is the perception and belief that you understand and can meet your baby's needs, and you have the skills and ability to care for your baby. And having that kind of confidence as well is an indicator of a successful transition to postpartum. So confidence plays a part in our whole experience. So traditional birthing education can sometimes let us down. It focuses on, it usually does a pretty good job of focusing on newborn education, on preparing for different types of labor scenarios, for learning those coping methods, which of course are all important. But if we don't believe we have the ability to birth, and we believe our birth experience belongs to someone else, then none of what we learn really matters, because we're not able to use it to actually enact, some of those coping methods. So we wanted to really make sure that you understood this link between confidence and these positive birth experiences, as well as that decrease in pain. And so because of everything we just talked about, we can see how confidence going into labor definitely impacts you throughout the whole process. But we wanted to kind of get a pulse for what else folks think might lead to confidence during birth. So obviously we talked about believing in your ability to birth, believing in birth as a normal process, and that your body is actually physically able to birth. Does anybody have any other ideas about what might lead to greater confidence? You can put it in the chat. You can unmute yourself, whatever works. We're a small.
I don't know. Like maybe feeling connected to whoever your team is, like your doctors also making you feel like it's something that's possible.
Yeah.
having like a
Yeah.
doula.
Definitely. You hit two of them, two out of the four that we are going to mention. So, yeah, definitely partner support. So, that can be either your actual birthing partner, your spouse, your partner, friend, whoever's going to be there with you, or your doula or your doula. And also the inclusion of patients involved in their own decision making. Those are two really big other ways that lead to confidence and positive experiences. The third is that you've had a previous positive experience with a pregnancy, which obviously that makes sense, right? If we do something and we know it went well, or even if it didn't maybe go well how we thought it would, we know better, right? We know how to change our tactics, we know how to prepare differently, but having that positive experience obviously gives us more confidence. And then the last Nancy has studied is that Black and Hispanic people also go into birth with more confidence, and so they have a leg up on other folks. So we are seeing those four things kind of be a part of how folks can increase their confidence, or what led to greater, I shouldn't say what can, but what led to greater confidence during birth. Yeah.
I love thinking about how confidence during birth will also affect your confidence during parenthood too. I see that
Yeah.
as a big role, as my job as a doula is to help empower parents that they know what to do and that they have this
Yeah.
knowing about their bodies and about their babies. And I feel like that also will probably set up people really well for the rest of their parenting journey, is like feeling confident during birth
Yeah.
and feeling
Yeah.
confident
Yeah.
in
I mean,
parenting.
totally. Totally. And when we think about like how just in general society like doesn't encourage confidence in our bodies, right? Like everything around us is like telling us that our bodies are wrong, especially if you live in a larger body, right? Telling us that we
Mhm.
don't meet these ideals, we don't meet these standards, you can't shop in a regular clothing store, right? All of those messages lead to or contribute to, you can't do this, right? Your body is not able to do something. And I think unwinding that is one of the biggest challenges that I had during pregnancy. And then I know some of our clients do, is like erasing some of that programming to believe that our bodies are wrong or bad or not capable, and changing that around, changing that message around into like, no, I can totally do this. Like birth is a quote unquote normal process. I don't like the word normal because that means other things are abnormal, but it's a part of life, right? It's something we do often. It's something our bodies really know how to do. And getting back in touch with that kind of sense of, like you said, that sense of self, I think is one of the greatest things that folks can do to prepare for birth, and can have a big impact. So yeah.
Mhm. So today we really focused on this crucial link between confidence and how it leads to reduced pain during labor, and helping people feel confident, and giving folks self-advocacy skills so that they're able to talk to their partner, are two of the big things that we are have built into a course that we made. So we're going to tell you a little bit about that now.
Oh, yeah, this week is really meant as a taste for how we teach, what we love, what we talk about. Hint, hint, it's birth and education, right? We love both of those things and combining those things. So we have actually created a really in-depth course called Empower Your Pregnancy, which includes topics like we talked about today and a plethora of other topics, that really lays the foundation for knowledge, for either newly pregnant folks or those who are trying to conceive, that might be having a hard time finding a care team, might be having a hard time building this confidence, might be having a hard time knowing that they can do this. Especially in a larger body. So this course is really meant to uncover the roots of anti-fat bias. Where do they come from? How do they deeply show up in prenatal care? What can you do about it? How do you talk to your providers about that? How do you even find a provider that's going to support you in the body you have now? So we have addressed all of those questions and all of those answers and all of that research in this course that we have built. And Emily's going to talk a little bit about the layout, the function, and then we'll make sure to leave time for any questions afterwards.
We like to say that we are birth junkies and we're also education junkies. So we're obsessed with finding a platform that could do all the things that we needed it to do. You're not going to be going through just videos of us talking at you. That is not good education. So from our course, you can expect it. We have this amazing learning module, amazing learning platform for you. It's 8 different modules, and we have an integrated course workbook, which was one of my favorite things about the course. It's embedded into the course. There's no need to go outside anywhere else. It's downloadable after you're done and entered all, your answers and things like that. And it really does a great job of doing a lot of self-reflection pieces and learning about yourself. When you birth, it's really about knowing you. And so that's kind of one of the ways that, this will prepare you for that. We do have some video lessons. We have all kinds of extensive content. All the resources that we've been gathering throughout the years of our own experience, we share with you in the course. And you'll also be able to build a size-inclusive birth team, confidently broach topics with your medical provider. And we also have 6 live weekly support calls that we'll be doing with anyone that's enrolled in the class. So that will be 6 hours of time with us and everyone else in the class. It'll be a great way to ask questions or to delve deeper into material that's interesting to you. So we'll have lots of opportunity to talk about that more. And we'll also be building our community. So we'll do that through those weekly meetings, but we are also going to have a specific community built into this course community working section. So you'll get to know the other people in the course, build community with people who share the same identities as you do, which is, really helpful and really important as you're starting your parenting journey.
Yeah, Emily and I went to FatCon at the beginning of January, which was a big convention celebrating fatness and all different aspects of life. And I was telling Emily that I don't think I've been in a room with that many fat people ever, and fat people who were on the same journey as me, believing in themselves and the work of body liberation. So it was just really powerful, and I didn't quite realize how much community I was missing by not having this in my life. So it was really important to Emily and I from the beginning, even obviously before FatCon, to have this community piece so that folks can talk to each other, can talk about things that they're experiencing that maybe straight size folks might not experience. And have a safe, protected space to do that. No one from outside the class is allowed in the community. It is closed to only those who purchase it. And Emily and I will moderate the community to make sure that it's staying safe as possible and inclusive, and that folks are, actually using it for good. Not that we expect anybody not to, but just to make sure. So, yeah, I'm looking forward to that piece.
Me too. So for now until Sunday evening, we are offering the course at $250 with a $75 off for this coupon code early bird. After Monday it'll go up, but we don't have a restriction on that code, so as many people that want to use it are welcome to. And then the course will open on February 12th.
Cool. Thanks, Emily. So yeah, we're gonna go ahead and talk about we're not gonna talk about anything, hopefully. Well, that's not true. We're gonna talk about stuff, but we're gonna make sure that we have time for Q&A. This was really important. We wanted to focus a little bit less on content and more on leaving this space for folks to ask questions. So feel free, you can unmute yourself, you can throw it in the chat, whatever works. I'm gonna go ahead and stop sharing the screen so you can see our faces. And then I'm also going to, Emily, should I end the recording and not record the questions? I can't remember what we normally do.
I would say, why don't we pause the recording in case anybody